The Pharmaceutical Society of Ghana says it is working round the clock to supply essential medicines that are needed for the treatment of Covid-19. A member of the Public Health and Communications Committee of the Society has disclosed the country does not have all the medication recommended by the World Health Organization. Speaking at a stakeholders meeting under the auspices of the Ministry of Information, Dr. Mark Giradosi assured measures have been put in place to address the situation.
We have put together already protocols and SOPs for our members. We've put together handouts and communication material for the general public. We've acted a few videos that have started, have actually gone into circulation. And the big one is we're working with Ghana. We've reviewed the treatment protocols and everything else. And we've looked at the medicines that are key in the management, because a lot of the protocols that have come from WHO and the CDC and so forth, some of the medicines actually are not in Ghana, and we have to take measures to quickly bring them in to make sure that if we have active or any confirmed cases and they require intensive care and other things, we'll be able to properly manage them in Ghana. So that is what we have so far.
Meanwhile, Information Minister Kojo Nkrumah has condemned the sharp rise in the prices of goods on the market, especially hand sanitizers. He spoke at the same event.
I'd like to appeal to people who sell various products that can help in this cause. This is not the time to be unduly profiteering with your products and your services. Like the President said yesterday, these are not ordinary times. These are the times when we have to come together as a human species and ensure that we do things that assure the survival of each and every one of us.
Authorities of the Kwame Nkrumah University of Science and Technology have given students up to Friday to vacate the halls of residence in line with government's directive to close down schools. International students will, however, be allowed to stay under special arrangements. At an emergency meeting on Monday, management also decided staff and students who have traveled abroad will be quarantined and screened on return. Meanwhile, students of second cycle schools have been leaving the various campuses. Here's more with Love FM's Erastus Asari Donko.
An almost deserted campus less than 24 hours after the president ordered the closure of all basic second cycle and universities due to the coronavirus scare. Mid-semester exams scheduled for today and all other activities have been postponed indefinitely. An emergency meeting of university authorities has decided, among others, students should leave the various halls by Friday. Dr. Daniel Norris Bequin is the University Relations Officer.
That the university is shutting down and all students are supposed to leave the university to their various homes by Friday. International students are, however, allowed to stay because of the closure of borders. Now, the university hospital or the team of experts have also been established to monitor the situation on the ground and continue with public education on the possible ways of preventing the infection of COVID-19. Again, staff and students who are outside the country on exchange programs will be quarantined when they return, and they screen. And those who are infected will be referred to the regional center established to handle this pandemic.
At the various senior high schools, students have been filing out of their campuses. We were told at St. Louis Senior High School, arrangements have been made to transport students who live outside the region starting tomorrow. At the Kumasi High School, many students were seen leaving as their final year colleagues settled to study. Headmaster Bernard Hall Bedu says all GES directives have been followed.
Instructions are very simple. First years, second years, they are to go home. The final year students are to stay. And you can understand why, because they have their exams upcoming. And if you allow them to go home today, nobody can predict how it's going to be like when they are ready for their exams. And so I think that it's a very good decision. We are ready to go by it.
Meanwhile, a peep at the Kumasi South Hospital by the news team revealed strict hand washing and screening of patients and staff. Reporting for Joy News, Erastus Asaredonko, Kumasi.
And still on fallouts of this coronavirus, long queues are beginning to form at supermarket and shopping centers as the ban on public gatherings take effect. President Akufo-Addo directed an indefinite closure of schools and placed the ban on public gatherings as the country confirmed 6 coronavirus cases. Supermarkets here in Accra have since seen a rise in sales as customers continue to troop in to shop for fear of food shortage. Aisha Ibrahim visited one of such supermarkets at North Kanishi in Accra Monday and filed the following report.
This is the Awenyame supermarket. The place is crowded with customers buying toiletries, groceries that will take them longer than they will normally buy. The shelves are virtually getting empty. Let's get in there and see what is going on. Most shelves at all branches of the Awenyame supermarket at North Kanishi and Atiko in Accra were virtually empty as scores of people shopped in large quantities for fear of food shortage in the event of a shutdown.
It's just coincidental that I happen to, come around today. But then looking at the way people are rushing for the items on the shelf, I just have to increase because you are not sure what will happen the next time you have to come and do your normal shopping. Into the shop and then everybody rushing for the items, the shelves are almost empty. That is what triggered me going more than maybe my normal budget.
Items including sanitizers, disinfectants and toilet papers are already running out. What are some of the things you
coming into the shop? Dettol and those other items.
That reminds me, I need Dettol too. Let me go get one.
I think the last on the shelf.
Oh my goodness. Manager at the supermarkets says sales has tripled after the confirmation of the first COVID-19 case in Ghana last Thursday. The good thing though, workers at the supermarket confirm there is little exchange of cash as many opt for electronic payment.
People are using a lot of their ATMs and mobile money since they don't have cash on them because some are not prepared to buy the stuff, but when they come around and they see what is going on, they have to buy.
Aisha Ibrahim, Joy News, North Kanishi.
Well, some traders at the Agbogloshi market, also here in Accra, are opting for the locally brewed gin, popularly known as akpeteshi, to disinfect their hands in the wake of the coronavirus spread. There's presently an astronomical increase in the price of regular hand sanitizers, and as shown in our earlier conversation, well, the traders believe that alcohol content is capable of killing the virus, just like the sanitizers. Joy News' Mamiesi Thompson has more in this following report.
A cucumber seller demonstrates how she uses the akpeteshi to disinfect her hands. She pours a bit of the quarter-filled 500ml bottle into her palms and rubs till it fades into her skin. She trusts that this procedure has killed any virus and is ready to serve her customers.
The
akpeteshi serves the same purpose as the sanitizers for me. I am able to use it for a day or two, and it helps sanitize my hands while handling money and even shaking people as well. She's not the only one who has embraced this new style of protecting oneself from the spread of the coronavirus. Her colleagues have bought into the idea.
I use sanitizer and akpeteshi. They say akpeteshi. So this morning I use akpeteshi and sanitizer to wash my hand because of the alcohol.
It used to be 2 cedis, but now it has become 8 cedis. And our alternative is to use the akpeteshi. Even though their new style hasn't been proven scientifically, it's a better alternative to the now expensive hand sanitizers. The 2 cedi bottle now sells at 8 cedis and the 5 cedi bottle now sells at 12 cedis. This trader is very unhappy about the situation.
How many people can afford it now, especially the poor? Imagine a family of 2 or 4 children. How will they manage? It's very disheartening.
But vendors have been justifying the prices. One of them who attempted to explain says they have no control over the situation.
Very early this morning, I had to go and restock, and the prices had ballooned. It is not my fault.
Meanwhile, Akpetishi seller Auntie Lizzie is happy her Akpetishi is moving. While there, she serves a customer.
The young men enjoy the akpeteshi. They say it helps their health, and they also use it as a sanitizer.
On the other hand, other traders are ensuring consistent washing of their hands as a protective measure. For JoyNews, Nyamiche Thompson.